Hello, St. Michael's Lutheran community. I'm glad to be with you and your Religion and Life program. Today, we're going to talk a little bit about feelings and a deeper look at anxiety. My name's Elena Geiger-Simpson, and I'm a clinical assistant professor at the University of Minnesota. I teach in the School of Nursing, primarily in the psychiatric mental health nurse practitioner program. I also practice as a psychiatric nurse practitioner and work primarily with children and adolescents. So today we're going to talk about feelings, stress, anxiety, fear and worry, and anxiety disorders. A real exciting topic for all of you this morning. A little information about me. I have very strong ELCA Lutheran roots. I grew up in the church. I am a PK and have been involved in a lot of different Lutheran communities. So you can see a couple on my slide here. I'm a graduate of Luther College. I have a bachelor's degree in Spanish and nursing from Luther. I also did some work at WAPO, Lutheran Bible Camp, and know that there are some folks at St. Michael's who have connections with WAPO. I also am a member at Our Savior's Lutheran Church in Minneapolis. And yeah, so I'm a Lutheran. My background professionally is in nursing, and I worked after graduating from Luther. I worked as a nurse in community mental health, working with adults with severe mental illness, visiting them in their homes. I also spent some time working on a team that served adults experiencing both mental health problems and homelessness. And then I went back to graduate school and got my doctorate, my Doctor of Nursing Practice in psychiatric mental health nursing. And now teach at the university and also have a clinical practice, as I mentioned earlier. I also wanted to note there's a basketball hoop on this slide. And when Chuck reached out to me about giving this presentation, we ended up making a connection over basketball and found out that he actually probably watched me playing basketball when I was in high school. So fun, interesting connection. So I want to lead you all through an exercise that I do with a lot of the kids and adolescents who I work with. If we were together in person, I would have you do this exercise for 60 seconds. But because pausing and being silent on a PowerPoint virtually for 60 seconds is a long time, we're going to do it for 30 seconds instead. So here's what I want you to do. I want you to get out a pen, a pencil, and a piece of paper, or if you're on your computer, a note or Word document, so that you can type things down. So the exercise is for you to take 30 seconds and write down as many feelings that you can in 30 seconds. So I'm going to start the timer here in a minute, or not in a minute, but in a couple seconds. I'm going to open it up and ready, set, begin. All right, stop. So take a couple moments and count how many words, feeling words, were you able to list. I find that some of the kids that I work with have a hard time writing a lot of different feelings. So when we think about feelings, emotions, anxiety, stress, Really beginning to develop our language around feelings and building our vocabulary for different types of feelings can be really helpful. Another exercise that I do with the patients I see is a feelings check in. So I want you to take a moment and make yourself comfortable if you're sitting, make yourself comfortable, if you're standing, just begin to notice your body. And I want you to think for a minute about how you are feeling. What are you feeling? You might write some of those descriptive words that you came up with earlier. Now that you've kind of identified what you're feeling, I want you to notice how it feels in your body. So, where do you feel it? And what do you feel? Do you feel relaxed? Does your stomach feel tight? Do you feel tension anywhere in your body? Notice how you feel in your body. So, what you feel, kind of tagging a feeling word, and then how it feels in your body. In addition to those other two exercises that I do with my patients, is I often will present them with a feelings wheel and have them highlight as many feelings as they know. And then, kind of as we continue to work together, we start identifying other feelings. So I'm curious, when did you learn about feelings? And who did you learn about feelings from? Were you allowed to express your feelings when you were younger, when you were older? Were your expressions of feelings accepted, rejected? What was your experience seeing your caregivers and family members and friends share feelings and emotions? So just take a couple minutes and think about, like, what did you learn about feelings, and where did you learn about them, and from whom? So I hear from a lot of people I work with about what anxiety feels to them. But in preparation for this talk, I reached out to a few friends of mine who I know have experienced varying degrees of anxiety and anxiety disorders. And I was curious about kind of what anxiety felt to them. So here are some of the comments that I heard back from folks. Mentally, it's like having a voice constantly trying to tell me that the worst case scenario is going to happen in every situation all the time and that I have no control over it. Even when I know the objective, rational reality, I still have a hard time convincing myself to believe it. And my mind races from thought to thought or churns over the same thought over and over again without really being able to focus. Physically, it feels like not being able to catch my breath, losing my appetite, being completely exhausted and unable to focus on even small tasks, just wanting to curl up under a blanket and sleep for the rest of my life. Another person said, I feel anxiety mostly as a physical symptom. I feel nauseous, lightheaded, with some shortness of breath. I get racing thoughts, and makes it really hard for me to make decisions or feel any conviction in my emotions, questioning things and having a hard time rationalizing things I know to be logical. Often my anxiety takes one small issue and makes me feel overwhelmed about unrelated things in my life, as if all negative, as if they are all negative and the worst case scenario. Another person said, for me, anxiety feels like running on a treadmill that is moving too fast. For someone who enjoys the illusion of being in control, this feels very out of control. Stress, anxiety, fear, worry, these are all things that are very related, yet they're different. So we're going to dive a little bit into some of the differences between these things. I have a picture here of labradoodles. So I'm a fan of dogs. And you can see here that there are lots of very cute Labradoodle puppies, and they all look different, but they're related. As you all know, we have a lot to worry about: poverty and social inequality, racial injustice, work, finances, relationships, health, climate change, unemployment, crime and violence, politics. We're still living in a global pandemic, family, and so much more. So, no wonder that so many people are feeling this stress and anxiety, um, and just a sense of being worn down. So, what is stress? There is really no widespread agreed upon definition of stress. Because of this, it can be difficult to measure stress. Hans Sely is a Hungarian endocrinologist who coined the term stress, and he defined it as the nonspecific response of the body to any demand for change. The American Institute of Stress defines stress as physical, mental, or emotional strain or tension, as well as a condition or feeling experienced when a person perceives that demands exceed the personal and social resources the individual is able to mobilize. One of the definitions that I like is stress is the automatic response when something disturbs your equilibrium or causes a change to happen, a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. Which of those definitions resonates for you? Let's talk a little bit about the relationship between stress and anxiety. So, stress is a response to an external cause, like a tight deadline at work, an upcoming test, and a recent argument with a friend or a family member. And stress tends to subside once the situation has been resolved. Anxiety, on the other hand, is a person's specific reaction to stress. And the origin of anxiety is more internal. Anxiety can be characterized as a persistent feeling of apprehension or fear. We'll talk a little bit more about definitions of anxiety in some of the upcoming slides. Um, but unlike stress, anxiety persists or can persist even after the concern has passed. And if it persists and escalates and becomes maladaptive, it can actually lead to an anxiety disorder. And again, we'll talk about that in a little bit here. I want to dive a little deeper into some of the more specific types of stress. So, stress is not just one broad thing, right? There are different types. So, acute stress is really that body's fight or flight response. So, that survival response. The body prepares to defend itself, and it takes about 90 minutes for the metabolism to return to normal when that fight or flight response is over. Chronic stress is really the cost of daily living. So things like bills, kids, jobs, a global pandemic that is we're almost a year into. And this is the stress that we tend to kind of push down and ignore. And when chronic stress is left uncontrolled, the stress affects your body and your health. So it can have an impact, a negative impact on your immune system. Eustress is positive stress in your life. So there are things out there that are stressful that are actually positive, right? So things like marriage, promotion, having a new baby, winning money, new friends, graduation, things like that are all really positive things, but they can still be stressful. And then we have de-stress or distress. And distress is really stress in daily life that has more negative connotations. So things like negative feelings, acute financial problems, challenges at work, those things that kind of create um, that kind of negative, immediate stress that's not acute stress, but is unpleasant. So, we talked a little bit about stress. So, what's anxiety then? So, anxiety, per the American Psychological Association or the APA, they define anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. The National Institute of Mental Health um, says that anxiety is an expected part of life, right? It's a normal part of life that we all feel. Another definition of anxiety that I like is a normal emotion, again, under circumstances of threat, part of the evolutionary fight or flight reaction of survival. There are many circumstances in which the presence of anxiety is maladaptive and constitutes a psychiatric disorder. So just because somebody's feeling anxious and experiencing anxiety doesn't mean that there's something that it's pathological, right? Anxiety is part of our normal everyday life. Everybody experiences it, and it's actually really adaptive and helps us survive. So let's break down anxiety a little bit more. This image is from Stephen Stahl, who's a psychiatrist and does a lot. He's kind of known as a psychopharmacology guru. It's from his book, Essential Psychopharmacology. And I really love the way that he kind of breaks up anxiety. So he breaks it up into two different parts. So fear and then worry. And there are actually different areas of the brain and different physiological processes that happen that impact fear and that impact worry. I go much more into detail about those different physiological responses when I'm teaching about anxiety in the classroom, but I will spare you all of that detail today. So, yeah, so fear and worry. So, anxiety, break it down into fear and worry. And fear is an unpleasant emotion or normal state of apprehension of a threat or danger, right? So we see something scary, a lion's running out after us, our brain detects fear and then kicks into all of these automatic responses. With anxiety, the fear producing stimulus is either not identifiable or not immediately threatening. So with fear, the stimulus is actually life threatening, right? Or can be life threatening. But anxiety, it's not identifiable, and sometimes it's not even immediately threatening, right? A test, for example. If you get really anxious before a test, your body's going to respond in the exact same way as if your life was being threatened by a wild animal. I'm not going to dive into detail about the various parts of the brain and processes in the brain that regulate different elements of the body's stress response and fear and anxiety and worry. But I do want to talk a little bit about some of the changes that occur when the body is under stress or when the body is experiencing anxiety. So we'll talk a little bit about the physiological changes that occur, the emotional changes that occur, and some of the cognitive changes that occur. So here are some of the physiological changes that occur with the body's stress response or the sympathetic nervous system, that fight or flight response. So when our brains detect a threat, right? So if there's a wild animal running at us, our brain triggers, I'm in danger, and I got to kick in to speed to like survive, right? Because if I'm not able to run away or fight, then I'm done for. So our body automatically processes that fear and kicks into its survival response. So our heart rate goes up, right? Our heart starts beating faster so that we can get blood to our muscles so that we can fight or run. Our respiratory rate goes up, right? We start breathing faster and heavier so that we can get more oxygen pumped throughout our body. Our brain gets really alert, right? We increase our muscle tone. Our body needs quick energy, so our blood glucose levels shoot up. We start sweating. Our blood volume goes up, and we release hormones such as and neurotransmitters such as epinephrine, norepinephrine, and cortisol, which are those kind of stress activation chemicals in our body that help us feel alert and energized. Some other things, so those are all really adaptive, right? If we need to fight or run away from that wild animal. The things that you don't need when you're running away for your life from an animal or fighting, if you're going to be dead in a couple of seconds, you don't need to digest the lunch that you just ate, right? You don't need to go to the bathroom. You don't need to be able to give an articulate speech. So our areas of the brain that regulate our speech actually kind of shut down when our body's in that stress, experiencing that stress response. Sleeping, we better not be sleeping if we need to be fighting or running for our lives. Our immune functioning goes down, right? All of our energy is going to those processes in our body that are needed for survival in that moment. And then our pupils dilate. So our pupils get really big so that we can see everything around us. So those are some of the physiological changes that occur in your body when it is under stress. And again, really helpful if you're needing to run away from a wild animal or if you're needing to fight a wild animal to save your life. Not so helpful if you're getting up to give a presentation and you're feeling really anxious, right? All of a sudden you can't speak. Not helpful. You're sweating, right? Those are not helpful in situations that are not actually life-threatening. We experience emotional changes when we're stressed out or experiencing anxiety. Irritability, that's actually a diagnostic, one of the diagnostic criteria for certain anxiety disorders. I see that a lot with the kids I work with who have anxiety disorders, is they're just irritable and angry and they have these emotional outbursts. Feeling helpless, feelings of depression, feelings of worthlessness, being suspicious or jealous, withdrawing, not being as involved in things that people are generally involved in, crying, blaming self, blaming others, decreased interest. So those are some emotional changes that happen with anxiety and stress. There are also cognitive changes that occur when our bodies are under stress or feeling anxiety. If you think back to some of those quotes that I mentioned about what anxiety feels like, there are some of those elements on this list. So, distracted, forgetful, ruminative thoughts, right? That churning of thoughts, not being able to get things out of your head, anticipatory worries, so thinking about what's going to happen in the future, thought blocking, intrusive memories, lack of attention to details, decreased concentration. That's another diagnostic criteria. Focusing on the past or the future and not in the present moment. Reduced productivity, interest, reduced creativity, and then cognitive distortions. So those are all some of the cognitive changes that can occur. So I can't talk about stress and anxiety without talking about the stress vulnerability model. So the stress vulnerability model looks at how biological factors and other vulnerabilities combined with stress impact the development of psychological disorders. And here you can see, we have that intrinsic vulnerability, things like genetic factors, biological characteristics, psychological traits, low social support, substance use. Those are some examples. And then stressors. So economic adversity, racism, environmental trauma, interpersonal stresses or losses, occupational stress, stressful life events. So those are, that's the stress piece of the model. I also want to talk a little bit about ACEs, or adverse childhood events. So from 1995 to 1997, Kaiser Permanente Day and the CDC put on one of the largest studies that looks at how childhood abuse and neglect and early childhood trauma impacts future health and well-being. And the study shows an association, a pretty clear association between ACEs, those adverse childhood events or trauma, and health and social problems across the lifespan. So I like to use a little example to explain the stress vulnerability model, as well as kind of ACEs and impact on kind of capacity to manage these acute stressors. So I've got Marty here, and I also have Marta. Okay, so Marty, Marta. You can see that Marty's jar is a little smaller and Marta's jar is a little bigger. So let me tell you a little bit about Marty. So Marty is 24-year-old now. And when he was a young kid, he was bullied at school. His dad left when he was 5 years old. His mom had to work 2 jobs just to make ends meet. He experienced food insecurity. He lived in a poor neighborhood and was exposed to violence in his neighborhood. His mom experienced depression and post-traumatic stress disorder and anxiety. His dad, although he left, had alcoholism or alcohol use disorder and struggled with that when Marty was really young. And his uncle was shot and killed in the neighborhood. So Marty has experienced a lot of early childhood adverse events. I want to talk a little bit about Marta now. So Marta, again, Marta's got a nice big bucket, right? So Marta grew up in a middle-class neighborhood with 2 moms. One of her moms was a 5th grade teacher, and her other mom is a civil engineer. Marta was very involved in sports, especially soccer, and in theater. She has no history of mental health problems, no history of mental health or substance use problems in her family. She had a lot of really great social supports, a lot of good friends. She had a lot of her friends' parents and coaches in her life who were really supportive of her. So she had a pretty fantastic childhood. All right, so she is also the same age as Marty. Okay, so now I want to talk about kind of where they're at now, right? In some stressors. So what I'm going to do is I'm going to name some stressors, and I'm going to throw some balls in their corresponding buckets or jars. Okay, so they are both in graduate school and are pretty stressed out with graduate school. So we're going to throw a couple balls in their buckets. And Marty just had his roommate leave because his roommate couldn't afford the apartment anymore, and now has the stress of needing to pay for his apartment. So he's pretty stretched thin financially. Marta was working a great job and lost it during the pandemic, and was pretty delayed getting any financial support or unemployment. So it has some stressors of finances as well. They both have a really big exam coming up in school and are feeling pretty stressed about that. So we'll give them a couple balls. Marty has proposed to his partner, and they're planning a wedding in the middle of a pandemic. And while it is really exciting, there's some stressors. Marta also got engaged to her partner, and they are planning a wedding and also experiencing some stress. Marty's mom just got COVID and is in the hospital. So he's pretty stressed out because his mom has COVID and is in the hospital. One of Marta's mothers was also diagnosed with COVID and is in the ICU and stable, but you know, it's been pretty hard on Marta. Marty's car breaks down, and all of a sudden he can't get to his job. Marta also, her car breaks down, and she can't get to her job. So I'm going to pause there because you're kind of getting the gist of things now. But I just want to show you that Marty's jar is overflowing. So he can't take much more stress, right? So if he gets sick and has to get surgery, he does not have much capacity to manage those stressors. Marta, on the other hand, has a little more capacity to be able to manage some of these acute stressors. She's got a lot of room. So I hope that was a helpful demonstration. So just a reminder, kind of circling back, your body cannot differentiate between fear, stress, and anxiety. Excess stress, early childhood adverse events, can contribute to the development of anxiety disorders. And when we are assessing anxiety, assessing for anxiety disorders also includes assessing current stressors. I want to talk briefly for the next couple slides about anxiety disorders. So I love this slide. So you see a person laying on a couch with his therapist, and the therapist says, "You worry too much. It doesn't do you any good." And the client responds, "It does for me. 95% of the things I worry about never happen." So I get a kick out of that. A reminder that anxiety is an adaptive, necessary, normal human experience, right? We all experience anxiety. When it becomes maladaptive, that is when it can develop into an anxiety disorder. So anxiety disorders involve more than just temporary worry and fear. The anxiety does not go away and actually can really can get a lot worse. And to meet criteria for an anxiety disorder, the symptoms or anxiety needs to interfere with functioning or cause clinically significant distress. So if somebody's just anxious all the time and they're not really distressed about it, and it's not really impacting their functioning in school or at work or in their relationships or home life, then it doesn't meet criteria for an anxiety disorder. Anxiety disorders are the most common mental illness in the United States. About 40 million adults in the US, or just under 20% of the population, are diagnosed with an anxiety disorder every year. About a quarter of children ages 13 to 18 have an anxiety disorder, a quarter. That is a lot. Also to note that people who have an anxiety disorder are 3 to 5 more times likely to visit the doctor or provider's office and six times more likely to be hospitalized. So that's a pretty significant cost in our healthcare system. Here's another thing that I find striking. About 37% of those with an anxiety disorder received treatment. So less than 40% of folks who have an anxiety disorder get treated for their anxiety disorder. So just think if you look at that that statistic right above about kind of the higher utilization of the healthcare system, if folks with anxiety, if 100% or 90% or even 85% of folks living with anxiety disorders were being treated, it would decrease that kind of that burden on the healthcare system. Women are about twice as likely to be affected by generalized anxiety disorder, panic disorder, pardon me, and phobias than people who identify as men. So knowing that anxiety is a typical part of life and something that we all experience, and that anxiety disorders is the most prominent mental illness in the United States, and that there are rising rates of anxiety disorders, what do we do about it? Okay, talk about it. Let's talk about it. Normalize it, right? Having a mental illness or a mental health disorder is not a moral failure, right? It doesn't mean that you're not working hard enough or that you're doing something wrong. There is no health without mental health, right? Our brains are just as much part of our body as our body, right? They're not disconnected. Address those social determinants of health, that ACEs study, right? So working on that upstream approach and prevention. How can we help decrease poverty rates? How can we address the racism that exists in our country and in Minnesota? We have some of the biggest, as you probably all know, racial disparities. And Minnesota is a great place to live. We have really good outcomes in terms of like health and well-being if you're white. So addressing some of those local disparities that exist. And then working with individuals and kind of our communities to improve coping skills, right? Anxiety, stress, all these worries that we have are really distressing. So working with folks on increasing coping skills, right? How do we sit with these uncomfortable emotions and feelings, and how can we cope with them knowing that they're not going to last forever? Teaching emotional intelligence, again, really equipping especially our young people with the language around feelings and ways to manage those emotions and those feelings that are part of our everyday life. I've seen in our young people kind of over the years as I've worked in mental health that the stigma of mental illness is becoming less among our young folks, and they're talking about it and getting help and reaching out. But I also see this almost like paradoxical phenomenon of pathologizing any distressful or unpleasant emotion, right? So they're feeling lonely because they're not spending time with their friends at night. And they come into me and they say, I'm so depressed. And it's like, well, tell me about that. And they say, well, I just feel so sad when I'm at home and, I'm not out with my friends. And then I talk about, I do an assessment about all the other things that they're experiencing. And they're like, sleeping okay. And they have good energy and motivation during the day. And they're getting good grades and they're getting along with people, but they're just really feeling sad at night. So we have to talk about, well, are you depressed or are you feeling lonely? Right. So, really equipping kids with the language and the skills to be able to cope with those normal human, that full spectrum of emotion that we all experience at different times. Promoting self-care strategies, right? So thinking about our basic needs, right? Sleep is so important. Rest, to managing our stress and anxiety and promoting well-being. Exercising is a great way to treat anxiety. Completing that stress cycle. Um, Nutrition, what we put in our body, is really important, right? Our body and our brains work better when we're putting food that nourishes our bodies and brains. Engaging in meaningful communities, right? Um, which is something that you all are doing at St. Michael's. Finding communities where you find purpose and where you find meaning and where you have that support is really important, to maintaining our health and well-being. Therapy. Let's normalize that seeing a therapist is something that we all should be doing. I don't really like the word should, but that is a kind of a typical thing. And that there's not shame associated with talking with a therapist. And then, um, if all of those things and aren't helping, and anxiety has gotten to a point where it is has become an anxiety disorder and is getting pretty severe, then talking with primary care provider or psychiatric provider about if medication makes sense. So those are some things that we can do about it.